Hello, I'm John Foster, and I'm a physician who does Social Security disability exams. Today, I'm going to talk about the 4 principles behind the recognition of functional illness. As usual, my talk today represents my opinions only and not the official position of the Social Security Administration or any other medical body. I think that it's important to understand normal and abnormal psychology as it relates to manifestations of illness if one wants to understand functional versus physical illness. By functional, I mean symptoms and signs of physical illness that are generated by the mind rather than by physical illness or injury. As well, I'll be using the term sham to mean physical signs which are created psychologically rather than physically. The term doesn't reflect whether those psychological processes are conscious or unconscious. The first principle is the most important, I believe, and that is we normally suppress outward signs of negative emotion. That's regardless of whether the negative emotion is caused by physical illness, such as pain, or by psychological illness, such as psychological distress, anxiety, or depression. There's a good reason for this, and this applies to all mammals, not just humans. The most strong motivation comes from having both a reward and a punishment, a carrot and a stick. And we have both when it comes to suppressing outward signs of negative emotion. When we began as primitive hominids on the African savanna, the predators, such as leopards or eagles, tended to pick out the easiest prey, and that was the hominid who appeared injured or ill. There was no point in trying to catch the healthiest, hardiest human. The carrot is that we are normally attracted to mating with healthy appearing members of the opposite sex. So you have a strong carrot, the ability to obtain a mate, and a strong stick, the need to avoid predation and being eaten alive, motivating you to conceal any evidence of physical or psychological distress. We can see this in our pets. If any of you have a cat or a dog that has been sick or injured, you know that they tend to crawl off into a corner and hide rather than to make a spectacle of themselves unless they are extremely ill or injured and near death. The same is true for humans. We want to appear healthy. The next principle is to understand the big 5 personality traits. I'm going to include a link in the description to a detailed description of these traits by Dr. Jordan Peterson, but basically the traits are extroversion, conscientiousness, agreeableness, neuroticism, and openness. All of these traits occur in a continuous spectrum from the most one-sided to the most other-sided. They never are isolated, and the same is true for all manifestations of psychological illness. They all occur on a spectrum from healthy to extremely ill. Arbitrary divisions, such as those found in the DSM-5, try to make a clear-cut distinction between psychological health and psychological illness, But understand that these divisions are merely arbitrary, and all manifestations of psychological illness sometimes occur in normal, healthy people. For example, if your beloved dog of many years died, no one would think that you were psychologically ill because 3 days later you had crying spells and had lost interest in what is normally pleasurable to you. However, if you were still in that psychological state 3 years after the dog's death, nobody would think that you're psychologically well. So where would be the cutoff? At exactly what point would grief for your dog transition from normal to pathological? Obviously, there's no one clearly identifiable point. The other thing is that all manifestations of psychological illness occur to some degree and at certain times in normal people. Even the most extreme manifestations, such as hallucinations. If you've ever had a grieving patient who's lost their husband or wife of many years, it's often a good idea to ask them if sometimes they hear the person's voice when they're alone in the house. More than half of bereaved patients do hallucinate the voice of their former spouse, and many of them will burst into tears when you explain to them that this is normal and not a sign of them losing their minds. Visual hallucinations are also experienced by all normal people, except instead of having them occur while awake, we have them while we're asleep, and we call them dreams. A final principle is that the patient's behavior may be due to conscious or unconscious factors, and that there exists a continuum between the two. We can rarely be 100% certain what's driving a patient's behavior, although there are certain tells or clues. In my next video, I'll be talking about some of the historical factors that point towards functional illness. That's all for now, and always remember, if it happens, it's possible.